Gauteng, permanent delegates to the National Council of Provinces have been on an oversight visit to the Hani Baragwanath Hospital as well as Maxeke Academic Hospital today. This comes after numerous challenges reported recently, including issues around staff shortages and that fire that gutted the Maxeke Hospital last year, rendering sections of it non-operational until December of this year, we're told. National Council of Provinces chairperson Amos Masondo is joining us now to talk about these visits. A very good afternoon to you, sir. Good to have you on Newsfeed PM. I suppose a good place to begin would be with your assessment of public healthcare facilities in Gauteng. What state are they in?
No, thank you very much. And greetings to you and all the viewers. We are visiting Hani Baragwanath Hospital today, and also, as you have pointed out, visiting Maxeke Hospital. The rationale is basically that from time to time, the members of parliament who are in the National Council of Provinces, the NCOP, go to what we refer to as the provincial week. This is really meant to ensure that the members of parliament keep in touch with the provinces and retain a sense of the ongoing challenges facing provinces and interact with the situation with a view of assisting to find appropriate responses and answers.
Do you agree, sir, pardon me, do you agree then, based on the visit, with patients who rely on Hani Baragwanath Hospital, for example, that there is a desperate need for an improvement in the services given to patients there?
My sense is that very good work has been done over time, but that the pressures remain, and that in an ongoing manner, these issues require a more focused attention and a dedicated and committed leadership, as well as doctors, staff, administration, and management to address in a meaningful manner. So what I want to say is that there's ongoing work. And the sense I'm getting is that there's some progress, but this progress is not enough. More needs to be done to advance the delivery of quality health care to a different level. And
what to you are the biggest challenges facing Hani Baragwanath Hospital specifically, based on these visits?
Well, the challenges are many, and just to give you a bit of a sense, there's ongoing challenge of ensuring that the staff establishment is what it should be. There's a question of unfunded posts, about 509. There's a whole question of the old infrastructure that needs to be addressed in relation to addressing issues of refurbishment and related matters. There's a question of the staff turnover and work overload. Overall, also I think that there's this question of a budget which is seen not to be enough. Although of course we continue to argue that although there may be budgetary problems, but we need to ensure that the principle of doing most with the least allocation is the best way to, in the longer term, meaningfully address the issues.
But workers at these hospitals say they've already done most with the least, and with some of their colleagues set to disappear when the temporary contracts signed during COVID are not renewed, they're likely to face more pressure. So is that not an unfair position to put both workers and patients at these hospitals in?
There's always a temptation for people who work in in important institutions such as the health institution to demand more and more money. But the practical, sustainable way is to really to ensure and demonstrate that the resources that are there are being efficiently and effectively utilized. And one way of doing that is really to answer the question, are we able to do the most with the least? That requires more resources to be allocated. We do so with an understanding as well that a lot of work is being done by the leadership and management of these institutions to ensure that the most is achieved. Because indeed the struggle to deliver quality health care is a complex and difficult one. But I'm of the view that some important achievements and milestones have been realized.
So it's one thing to use resources optimally, but it's another to expect healthcare workers to do more when we know that in many of the public hospitals in this country there has been an issue about the patient-to-doctor ratio, patient-to-nursing staff ratio, which is concerning. And ultimately, that then poses an issue as far as the ability of hospital staff to give the best quality care to all patients at all times. Do you agree, sir?
The challenges remain, but I'm of the view, as an optimist, that many of these difficulties can be overcome.
So what then will be the purpose of these visits if we're going the optimism route? After the NCOP has conducted these visits, what is going to change?
Optimism is not just some idealistic notion. Optimism is also about practical implementation and addressing the realities in an ongoing manner.
Mm-hmm. Would you agree with people who say that the state of our public hospitals is perhaps one of the biggest failures of the government of the day?
It's not where it should be. But a lot of work can be done to ensure that the backlogs and the issues that need to be addressed are indeed effective.
So it has to a degree been a failure.
Don't talk about a failure, because that's an extreme position. That suggests no work is being done, nothing is happening, there's hopelessness, and as we move into the future and so on. That's not what I'm saying. What I'm saying is that there's ongoing work, and we've got confidence that these matters will be effectively addressed. Of course, there's a lot of work that needs to be done to ensure that this indeed becomes the case.
So we can at the very least agree then that the government's running of the public healthcare facility then, at the very least, is a far cry from excellent.
We're not where we should be, but we're not at the same time in a situation that indicates hopelessness and lack of focus and not direction.
But how much longer?
Let's accept it that the reality of the situation is that we're not where we should be, but work is being done, and of course we are urging, as the National Council of Provinces, that a bit more focus, a bit more leadership, a bit more commitment is required.
But, you know, it's one thing for you and I, sir, to be work is being done to improve the situation, but it's a whole other thing when you have this conversation with families such as the family of the gentleman who died during the COVID-19 pandemic. I think it was at the Tembisa hospital because he hadn't been fed for a number of days. And there are other families who say they've had loved ones die in casualty wards waiting to be attended to because no one cared or no one had capacity to treat them at that time. And how much longer should families have to live through and endure that kind of horror? Because these are mainly people who very often, Mr. Masondo, have no option but to go to a public facility and are unable to wait for things to get better in 5 or 10 more years when their loved ones are dying now. I mean, you've got in Gauteng a situation since the fire at Maxeke, oncology patients who say they think cancer is going to kill them because their ability to access regular care has to some degree been affected.
Let's accept it. I mean, to the media, bad news is good news. And it will remain so for many, many years to come. But also there's also a misrepresentation of the truth. You know, when we were at the Baragwanath hospital today, we learned that in fact, there was never a shortage of food at the institutions. What happened was that there was a shortage of bread. But the way it came across on television, in print media, and social media, and so on, was this negative representation of the situation to the extreme. So this is very unfortunate. But yeah, we're not after bad news.
But bad news.
We know that there are weaknesses, and these weaknesses are laid bare. We discuss them frankly,
okay,
and without any spreading any limits in this regard.
Okay,
but we refuse to be mired in negativity.
Well, it's not negativity, sir, if it's fact. If there are bodies, people who've died as a result of poor healthcare in the public sector. So whether one wants to be optimistic or not, if someone is dead, it's a fact. It's not a focus on the negative. It's what has happened.
I'm not sure what you expect of me from that kind of comment. What I'm saying is, yes.
Do you agree that it's fact? It may be bad, but it's fact.
This needs to be addressed, and our sense and assessment is that the situation is being addressed in an ongoing manner. We are not very happy as the NCOP at the extent of successes that are being scored, but we can't deny that there's some good work that is being done, and we're moving in the right direction.
Amos Masondo, chairperson of the National Council of Provinces. Good to have your time, sir. Thank you.